Hello and welcome to another episode of the Morning Brew live on NTN. We are back in studio, the GIS studios, and we'd like to welcome you. Thank you so much for tuning in. If you're watching from St. Lucia in the diaspora, we'd like to welcome you this morning as we bring you the latest developments from the government of St. Lucia. My name is Jessie Leonce. Today is Wednesday, the 14th of October, 2020. And among the many observances that we've seen so far for the month, we have a Credit Union Month being observed this month, also International Credit Union Day being observed tomorrow, Thursday, the 15th of October. And with that, we'll be having this morning a special interview with Mr. Lucius Elevic from the St. Lucia Cooperative Credit Union League Limited to speak to us on the observances for this month, as well as the history of the movement, give us some insights into the benefits of being a member of a credit union, and so many more things that are emerging from that sector. So stay tuned for that. That is coming up later on in the broadcast. Meantime, the headlines: the Ministry of Health and Wellness is investigating 2 new dengue-related deaths, and nearly 300 COVID-19 tests also still in health. 300 COVID-19 tests conducted in relation to the island's latest positive case come back negative, thankfully. And we also have a COVID-19 outreach that has been scheduled for the community of Deriso. I'll have the details to that in just a moment. A St. Lucia Citizenship by Investment program is rebranded with an upgraded website, and the details to that also coming up in just a moment. And Sufra Comprehensive Secondary School is gifted a smart classroom. The details to these stories and more coming up right after this break. Do stay with us. You're watching The Morning Brew live on NTN. We're bringing you the latest news developments coming from the government of St. Lucia.
St. Lucia ka registré vermin corona ek I ka fait mouvement ek an chay vitesse tan chaque canef ka kouye pour vigilance publique la fait wolo parler en place publique kon bon lanme base ti boutique changer distance sociale 6 pieds rodion à l'autre I ka travail tan. Si vous sentez qu'on pas cordial, quarantine qu'on pas en contact et puis l'autre en cas où tu es exposé. C'est un écuyer free one ou ben n'importe clinique qui au pour. Les pays à 10 000 à clé, ça veut dire les supermarkets, pharmacies et puis ATM, yo accessible avant c'était souhait. Pays à clé en plein. Ça veut dire tout bagay fermé à 24 heures. Servi protocole comme sorti par bureau indication santé. Nous tout ensemble, ça sauver vermine corona. Si nous tous servi jidla à toutes les.
Together let us win this war. St. Lucia be a soldier. Together we can beat this corona.
She's been watching. Waiting, wondering when the sands of time will give way to a tide of change, and for yesterday and today to become a new tomorrow. For a time when her sun can kiss the cheeks of your loved one, and her stars can twinkle in her honeymoon skies. When her earthly embrace will reassure and calm your soul. And her unique view can change your whole perspective. Proudly, she has risen to meet new challenges and to provide safe harbor to all who reach her shores. For her hopes and dreams still stand, shoulder to shoulder, a precious reminder of experiences yet to come. So, wherever your moments and memories take you, let her sense of adventure set you free. She is St. Lucia. Let her inspire.
Thank you so much for staying with us. I did indicate earlier that as part of a credit union month observances for the month of October, we'd be having the interview with Mr. Lucius Elevic this morning. Mr. Elevic from the St. Lucia Cooperative Credit Union League. However, he will be joining us tomorrow, so do tune in tomorrow for that special interview as we observe International Credit Union Day tomorrow, Thursday, the 15th of October. We continue with the latest developments from the government of St. Lucia. The Ministry of Health and Wellness is currently investigating two dengue-related deaths. Both individuals were seen and managed at the Owen King European Union Hospital, where they presented with a clinical picture consistent with dengue fever. All samples were tested locally for dengue virus and have been sent to the Caribbean Public Health Agency, that is CARPHA, for confirmation. The Ministry of Health and Wellness awaits these confirmatory results, and to date, St. Lucia has recorded one confirmed dengue-related death and is now investigating these two new cases. National epidemiologist Dr. Michelle Fassois is urging the public to pay close attention to the signs and symptoms of dengue fever.
In its mild form, dengue fever may present with fever, headache, pain behind the eyes, muscle and joint pains, and a red, itchy rash. There are several warning signs that persons need to be aware of. These include intense and continuous abdominal pain, persistent vomiting, which means 3 or more episodes in 1 hour or 4 episodes in 6 hours, bleeding from the gums or nose, bleeding in the urine or in the vomit or dark-colored stool, restlessness or drowsiness, as well as enlarged liver. Persons presenting with these warning signs should immediately seek medical attention. Approximately 5% of persons progress to a severe form of dengue infection. There is no specific treatment for dengue fever, and management is supportive based on presenting signs and symptoms.
As of October 3rd, 2020, a total of 540 confirmed cases have been recorded on island of dengue fever. The mean age of the cases is 19 years old, with an age range of 3 weeks to 84 years old. The age group 5 to 14 years accounts for approximately 38% of these cases, and 49% of confirmed cases occurred during the month of August, with both serotypes 2 and 3 continuing to be in circulation. Hospitalization rate among cases is 25%, and 65% of whom were in the age group under 14 years old.
Although all health regions have reported cases of dengue fever, the highest prevalence continues to be reported in the northern part of the island, with Castries, Gros-Islet, and Babonneau accounting for 34%, 17%, and 8% of cases respectively. In the south, Vieux Fort accounts for 14% of cases, followed by Dennery with 10% and Micoud with 6%. Among the northern settlements, Castries, Bexar, and Babonneau have confirmed the most cases, while in the south, Dennery Village and Vieux Fort Town confirmed the most cases. The public is reminded that both dengue serotypes 2 and 3 are in circulation. The likelihood of persons presenting with severe form of dengue is therefore increased.
The public is being asked to assist in the control of dengue fever by eliminating breeding sites, reducing the population of the vectors in and around their homes. This can be done by discarding of all open containers with stagnant water in and around your home on a regular basis. Also using insect repellent, which may be applied directly to your skin, to your clothing also, and also on mosquito nets. Wearing long sleeve shirts and long pants, especially during the hours of highest mosquito activity, also helps. We're trying to reduce these figures, contain this dengue fever situation that we have in St. Lucia. And again, we're calling on you to do your part. In other health-related matters, this time concerning COVID-19, Chief Medical Officer Dr. Sharon Belmont-George says the island's 29th COVID-19 patient is doing well at the respiratory hospital, that is the Victoria Respiratory Hospital. The 48-year-old minibus driver has had COVID-19 tests repeated and validated and has been confirmed positive. Since Saturday, 10th October 2020, a total of 500 persons have so far been reviewed in relation to this new case. This includes close contacts, minibus drivers, and commuters from the bus route and residents of the community. 283 tests have been done, and the results received so far are negative, thankfully. About 50 people have been placed in quarantine to date out of an abundance of caution. The community and contacts of the patients will continue monitoring these individuals for a period of 14 days to assess the impact of this case. We go to our next clip for the morning, coming from the Chief Medical Officer, Dr. Sharon Belmar-George.
This past weekend, in response to this case, investigations and contact tracing commenced in communities and amongst key populations of concern, and these activities are still ongoing. In addition, respiratory clinics were extended over this weekend to support contact tracing related to this case. The Constituency Council office in La Rochelle was set up as a community outpost to aid in accelerating assessments and testing. As part of the advanced planning for the possibility of a community outbreak, the present quarantine capacity and testing capacity has been reviewed, and the capacity for increased cases which may be required at the respiratory hospital.
The Chief Medical Officer says interventions in the more affected communities included health education and distribution of face masks at key locations, and the strengthening of preventative and control measures with the support of community leaders. And just to go through and to reference the latest statement we're receiving from the Department of Health and Wellness, COVID-19 outreach in the community of Dereso. As part of efforts to investigate case number 29 of COVID-19 and contact tracing efforts as well, the Ministry of Health will be undertaking the necessary interventions in communities, including assessments and health education. The Ministry of Health invites residents of the community of Dereso to an outreach activity at the Dereso Wellness Center on Wednesday, that is today, October 14th, 2020, from 4 p.m. to 7 p.m. for assessment and testing for COVID-19. The ministry asks for your cooperation and participation in this activity. So if you're from the community of Dereso, we urge you to please make yourself available between 4 p.m. to 7 p.m. this evening at the Dereso Wellness Center to be assessed, to be tested for COVID-19 to ensure that you do not have it. Or if you do have it, you can get the necessary treatment at the requisite facilities. And this is all part of, contact tracing efforts. The outreach that is happening is in relation to this latest case. And so we do hope that you can avail yourself. Going to the second clip from Dr. Sharon Belmar-George, she did indicate that there will be a strengthening of preventative and control measures with the support of community leaders within the community, especially at this time.
The scheduled social activities for affected communities are being reviewed to determine their adherence to protocols or the requirement for cancellation. This new confirmed case presents a high level of risk at the community level. We continue to appeal to the public to cooperate and share relevant information with the health team. We also remind the public that the Ministry of Health remains the official source of accurate information and should seek clarification at that level. The 5 community respiratory clinics remain open for persons with presentive signs and symptoms, and the 311 information hotline is available to help address COVID-19 related questions and concerns. The treatment and care for COVID-19 related conditions remain free of charge to the public.
That was Chief Medical Officer Dr. Sharon Belmar-George. Please be reminded, if you're from the community of Dereso, please, if you are able, avail yourself to an outreach activity at the Dereso Wellness Center today at 4 p.m. It's happening from 4 p.m. to 7 p.m. You will be assessed and tested for COVID-19, and this is on the heels of the latest, the patient number 29 COVID-19 diagnosis that was made recently. We continue. St. Lucia Citizenship by Investment Program has launched its new brand and enhanced website as part of an overall strategy to become one of the most visible, viable, and unique programs internationally. We have that story coming up after this break. Do stay with us. You're watching The Morning Brew live on NTN.
What's in the food you're eating? Do you really even know? All the chemicals and hormones used to accelerate their growth. All the artificial flavoring, sweeteners and colors too. We consume and we don't spare a thought for the damage that they'll do. No, think about the children. Think about the children. How will we save them? Chemicals and GMOs are not the solution. Use organic and join revolution.
Excessive agrochemical use, additives, and genetically modified foods are harmful to health and the environment. Join the good food revolution. Grow, buy, and consume organic. A message from Rise St. Lucia and the Ministry of Sustainable Development with funding from the GEF Small Grants Program, UNDP.
The good food revolution.
Overnight, growing national unrest.
Society, a digital cashless society, one world currency.
A vaccine for COVID-19.
Midtown.
Droplets of the virus.
Macy's iconic flagship. Set inside.
The coronavirus.
Everybody vaccinated
On the corona pandemic.
opposition to the lockdown.
An infected conspiracy theories
about the coronavirus. 5G.
The truth about the origin of COVID-19 hidden from the rest of the world. And the Chinese.
In this constantly changing environment, resulting in sensory overload, cut through the noise and tune in to the National Television Network, the official source of information, all facts.
Thank you so much for staying with us. The Taiwan Embassy and the International Cooperation Development Fund, ICDF, under the ICT for Educational Development project, have facilitated the creation of a smart classroom at the Super Comprehensive Secondary School. We have the details to the story in this report.
The new CIP visual identity incorporates the country's matriarchal brand, featuring the immediately recognizable famous pitons. However, the CIP notes that this rebranding is much more than a logo or a new look and feel in the market. It is the unveiling of an entire strategy in motion to develop and be perceived as the best run and most successful global citizenship program in the world. After 5 years of operating, the CIP is well poised to capitalize on an increased demand for investments via its citizenship program.
Even with COVID, when we would expect that there'd be a reduction of numbers, it is the best time that CIP has witnessed over the 5 years. And I think what underpins this is the basic principle that the issue of international mobility that is so required by people is not phased by whether there's a pandemic or not. Persons want to move and they want that international mobility. And for St. Lucia, I think we were at the right time, the right place. And I think the whole rebranding and the whole narrative that we've written will really put us in good stead and will continue showing those increases in numbers.
A highlight of the rebranding is the enhanced website with user experience and user interface capabilities to allow for secure online applications, and also serves as a powerful marketing tool with its rich content and information. The brand pillars and the tagline for the re-imaged CIP are authentic, respected, secured.
At its core here, the integrity of our program is of utmost importance. So, for example, audits. Our program is audited every year. The financial statements, the entire report of the audit is delivered on time to Cabinet in line with legislative requirement. From an integrity point of view, I can sit here and say very clearly that every file that comes to the boardroom, and indeed every file must come to the board to be decided on. So it's a board of 5 that decides on every file, and every file that comes to our boardroom has had to go through all of the regulatory due diligence, all of the private due diligence, and then all of our national security and international security partners.
Prime Minister of St. Lucia, Honorable Alan Chasney, is pleased with the direction that the CIP has taken under his leadership. Key benefits from the revenue from the CIP program include availability and ease of access to affordable funding for investment and the development in the country via the National Economic Fund, as well as improving the country's net worth and credit rating.
In addition to improving the credit rating of our country, is that it drives investment. So whether it's in healthcare, whether it's in education, whether it's in infrastructure, it makes free capital, monies that, in fact, we don't have to pay for. It's like having grant money to invest in our country. The difference is my government is not intending to use it as grant money. We think that it should remain as equity or as a loan even to government in order to preserve and make sure it's a sovereign fund.
The impressive performance of the rebranded CIP, even with the context of COVID-19, is good news for the country, as the program seems poised to become a significant contributor to GDP and the furtherance of national development goals. From the Government Information Service, Lisa Joseph reporting.
Well, what you just heard was the St. Lucia Citizenship by Investment Program, the launching of its new brand and its new website as part of an overall strategy to become one of the most visible, viable, and unique programs internationally. The CIP's rebrand coincides with its 5th year of operations. The program is now focused more than ever on using St. Lucia's citizenship in the furtherance of national development goals in the short to long term. So that was Lisa Joseph with that report. And now we have the Smart Classroom report. The Taiwan Embassy and the ICDF under the ICT for Educational Development project have facilitated the creation of a smart classroom at the Soufrière Comprehensive Secondary School.
The Ministry of Education, Innovation, Gender Relations, Sustainable Development is heightening the integration of information communication technology, ICT, in schools island-wide. The aim is to transform teaching and learning in St. Lucia through the use of appropriate digital technologies that engender a literate, creative, productive, inclusive, and competitive society. The Embassy of Taiwan in St. Lucia has been an integral partner in the implementation of the ICT in Education strategy. The Embassy, along with the International Cooperation and Development Fund, the ICDF, has provided for the transitioning of a smart classroom at the Soufrière Comprehensive Secondary School. Michelle Charles is the Permanent Secretary in the Department of Education, Innovation and Gender Relations.
The generous contributions of charging carts, tablets, laptops, projectors, Chromebooks, and other equipment sets this school well on a path for infusing technology into its instruction and learning. The presentation today is of tools and equipment necessary for the development of a diverse, educated, and resilient people. These are tools and equipment necessary for ensuring that our graduates and teachers are 21st century compliant.
Taiwanese Ambassador, His Excellency Peter Chen, has congratulated the Soufrière Comprehensive Secondary School for its keen desire in developing student interest in coding and robotics.
100 Acer Chromebooks, as you can see, and 50 tablets, numerous integrative displays and projectors will be provided today to the teachers and students of Soufrière Comprehensive Secondary School. These equipments are aimed to apply information technology in developing teaching materials for specialized courses and to create a smart learning environment. ICT opens up another dimension of learning. We sincerely hope that through the implementation of the ICT in education, Teachers and students will have the opportunity to explore different learning experiences and feel empowered and confident to pursue their passion and dreams.
Noting that the program meets the United Nations Sustainable Development Goals 4 and 9, which speak to inclusive and equitable quality education and fostering innovation, respectively, Principal of the Soufrière Comprehensive Secondary School, Joel Schalmine, hailed the ICT in Education project as a great vision for success in the school system.
Thank you, Madam Minister and Madam PS, for effecting change in the educational landscape of St. Lucia, not only with this project, but also the Pro Futuro digital education program, which will deliver similar benefits to students at the primary school level. Thank you to the Taiwanese government for equipping schools, us, SCSS, with what is needed, the equipment and the digital education training for teachers to be more effective in the classroom so that when students leave here, they are more ready to take on the world. They are critical thinkers, communicators, collaborators, and creative, the fundamental 4 C's of the 21st century, which will germinate and flourish from integration of ICT in education.
Among the items donated to the school are Chromebook tablets, projects, laptops, and projector screens. From the Government Information Service, Rajvaro Lawrence reporting.
Thank you, Roger. Do stay tuned. We'll have more news coming up right after this break.
We got this. Yeah. I feel make it. We don't have no other choice but to be strong.
You're gonna make it.
What do you mean? Why God?
I am a voice of hope, and I just wanna let you know that I believe in our strength as a people and the promise of a bright tomorrow.
And I want you to believe our trust.
And nobody's watching over us, and I believe if we all come together now, everything will be alright.
Thank you so much for staying tuned. This is the Morning Brew. We're now down to our final segment for the morning. The Ministry of Health and Wellness embarks on an immunization campaign to ensure that all children aged 0 to 5 years old are up to date with their vaccinations. Through October and also November, officials will conduct school and community checks to make up for any health service disruptions during the pandemic. We have a report on the launch that was held just recently. Data shows the immunization schedules of many children were interrupted since the onset of the pandemic in St. Lucia. In response, health officials have launched a vaccination sensitization campaign to restore the population's immunity levels, targeting children aged 0 to 5 years old. Medical Officer of Health, Dr. Glensford Joseph, gave an update on St. Lucia's vaccine status.
What we have observed is a fall in our vaccination coverage to 84%. And it is critical that we restore and maintain 95% or above vaccination coverage that will produce what is known as herd immunity.
Herd immunity is the resistance to the spread of a contagious disease within a population that results if a sufficiently high proportion of individuals are immune to the disease, especially through vaccination. The Ministry of Health and Wellness has developed a national vaccine registry to capture every child's vaccine record and has partnered with the Department of Education to commence a review of the students' health cards. School Safety Officer in the Ministry of Education, Bernays Kodra, encourages parents to cooperate when the health cards are requested.
Whilst you may not have gotten the opportunity to get your children immunized before the academic year, we want you to partner with your schools by bringing in the health cards to your schools so we can see how many children have been immunized and those who have not been. And for those who have not been, we want to encourage the parents. You can take your child to the nearest wellness center, or you can make arrangements with your school and a nurse will come to the school to get your child immunized.
The Ministry of Health and Wellness has also scheduled community outreach activities.
We'll also be conducting some community outreaches. So you will be seeing our health team within the various communities. Again, you will be told, it will be aired as to when this will happen. So it will also give you an opportunity. I know some persons may not necessarily be comfortable in going to the facilities at this time. However, we will be coming to you. We will be doing our community outreaches in addition to our home visits as well, to ensure that the children are covered and they do have all of the required vaccines necessary.
Media discussions have been scheduled and vaccination leaflets and public service announcements will be disseminated, all conveying the significance of immunization. For the Government Information Service, I am Jessie Leonce reporting. And finally, yesterday we brought you news of the St. Lucia Social Development Fund addressing and expanding to the southern education districts with its Our Boys Matter initiative. This agency, the SSDF, is also assisting St. Lucians in diaspora. That is an agency, Make a Difference Here at Home. We have a report from Anicia Antoine on this facilitation.
The St. Lucia Social Development Fund has been working closely with the Diaspora Office to help facilitate the donations received from the St. Lucia diaspora. The latest undertaking of the organizations is the establishment of a thrift shop in St. Lucia with the aim of assisting nationals here at home. The executive director of the SSDF, Alison Mathre, noted that the St. Lucian associations from Canada, the United Kingdom, and the United States have shown absolute commitment towards the initiative.
I think the challenge was they wanted to find something that they could unify, come together on to make a meaningful dent in poverty in St. Lucia. And we were able to present that to them through a proposal that we set up a thrift shop in St. Lucia that would be funded by the USLOE, if you will, through contributions. And at the end of every year, we would have discussions with a steering committee that comprises members of the SSDF and the USLOE to determine what the funds would go to, the proceeds from that. That was, to me, one of the most amazing experiences at the SSDF. And I think it's a watershed because there is no question that there are a number of St. Lucians living overseas that are very committed to helping St. Lucians in St. Lucia.
Martha expressed gratitude to Watch Radio and family and the St. Lucian Association of St. Croix, who have already made donations.
St. Croix, from the beginning, when we attended the biennial convention in the UK, from the beginning, they indicated that they were committed to helping, and they sent free barrels. This is not the first time they've sent stuff to us, and I'm very happy for Watch Radio. They seem very energized. Also, the Canadians have also been very helpful. They've done a house and what have you. So there is the will. There is the will from the associations in the US, the UK, and Canada. It is for us to match it here. And we are the SSDF staff. We are doing all we can to make this happen.
Ambassador for Diaspora Affairs, Her Excellency Dr. Joycelyn Clark Fletcher, expressed gratitude on behalf of the government of St. Lucia to the diaspora for all the assistance received, especially in the face of the COVID-19 pandemic.
So this is a difficult time, but we are very positive. We are looking ahead. We know that things will get better. We know that all the things we had planned for St. Lucia, for the diaspora, is on hold, but we are not giving up. We are holding on, we are praying, we are pressing on, and we will keep on receiving. We have next week, or I think it's a week and a half again, we will be receiving wheelchairs and things from the Diabetic Association UK, St. Lucia Diabetic Association UK, and so many others of you send it. This is what you can do now because you cannot physically come, and if your holiday is very short, you don't want to come and spend 7 days in quarantine, and you want to protect those in St. Lucia that you love. Thank you for understanding. Thank you for working with us and the government. Thank you for giving.
The handing over ceremony of the donations received from Watch Radio and family and the St. Lucia Association of St. Croix took place on Tuesday, October 6th, 2020. From the Government Information Service, I am Anicia Antoine reporting.
Thanks for that report, Anicia. Well, that brings us to the end of this morning, The Morning Brew, live on NTN. We'd like to thank you so much for watching. The Productivity Awareness Week of activities continues over at the Finance Administrative Center. We just came back here for today, Wednesday, but we'll be back over there joining them again tomorrow morning, Thursday, bright and early for the continued activities. Do stay tuned to NTN to find out what's happening today. I did mention the schedule of activities earlier this week, so stay tuned to NTN for updates on Productivity Awareness Week activities, and also tomorrow, International Credit Union Day, being observed tomorrow, Thursday, the 15th of October. We will be having with us Mr. Lucius Elevic from the St. Lucia Cooperative Credit Union League. And we'll also be having our friend from the Bureau of Health, that is Ngozi Naomi Grandison, and she will be speaking to us in light of the developments surrounding COVID-19, giving us some information on the dengue fever as well, what you can do to help treat it if you're sent home, what you can do, what methods, what medication you can take to help treat your symptoms. Thank you so much for watching. My name is Jessie Leon, signing off for now. I do wish you an enjoyable and a productive day. Goodbye.